Welcome to Zestful Aging, where I interview inspiring, fascinating women who are navigating aging with class and sass. I'm your host, Nicole Christina. Hey everyone, I am so grateful for all of the downloads, and I'd love a rating on iTunes and a comment. And please subscribe. It helps the show's rating so other people can find it and learn how to age well. And if you are loving the podcast, why not check out the companion online course, Zestful Aging, Simple and Sustainable Habits for Health and Longevity. You can access it through my website, NicoleChristina.com/Zestful Aging. It's based on the Harvard study of adult development, and I'm really proud of how it's turned out. Well, I've got my coffee in my hand and my trusty dog Sparky beside me, so let's begin. Today we have Dr. Lisa Nelson, who's the Director of Medical Education at Kripalu Center for Yoga and Health in Stockbridge, Massachusetts. And Kripalu is the largest yoga training facility in North America and, dare I say, the most beautiful. She is co-author of Yoga and Diabetes, which was published by the American Diabetes Association. And she works with numerous community groups throughout the Northeast to increase awareness about the treatment and prevention of chronic disease through changes in exercise and nutrition. Dr. Nelson has presented her work at the U.S. Capitol and the Library of Congress. And today we're going to focus on a subject that Dr. Nelson is an expert in, and I know a lot of my listeners have questions about, and that is bone health as we age. Welcome, Lisa.
Thank you. Thank you for having me. It's a pleasure to talk to you.
Yes, likewise. I think our listeners would be really interested in hearing about your take on staying healthy and preventing disease. I know that you've talked about the medical model being extremely successful for certain types of things, but it doesn't teach us lifestyle behaviors that can be very important. Can you elaborate on that?
Sure. One of the things that I do at Kripalu is I teach programs for clinicians, for nurses and doctors, and other health professionals. And one of the things that I like to remind those of us who are Western trained is that the whole really the framework of Western medicine is around what we call the acute disease model, or even the infectious disease model. And there are very good reasons for this. In the last century, between about 1900 to 2000, and especially in the early part of the last century, the three biggest threats to our health, the three biggest killers in the U.S., were actually tuberculosis, diarrhea, and pneumonia. So when our medical institutions were being established, both our treatment facilities and our training facilities, infectious disease was really the biggest threat. But over the course of that century, because of advances in public health, like sanitation and housing, and also treatment, we, reduced the threat of those diseases incredibly. Just an incredible reduction, so that now in this century, the biggest causes of death are heart disease, cancer, and lung disease. So it's an enormous shift from kind of acute diseases that can strike all of a sudden to these chronic diseases that develop really over a lifetime, over many years. And so our institutions, it really made sense that there's this focus on acute processes. But now times have changed, and the threat from what the World Health Organization calls NCDs, or non-communicable disease, or basically non-infectious disease, that's really what we're all struggling with. So some people are sometimes surprised and dismayed to learn that nutrition education is not even a required part of the medical school curriculum. It's actually elective, and many medical schools include it, but not all. And so it's just not a big part of our training, and therefore a lot of clinicians don't feel comfortable. And so we just don't even bring it in the room. We'll kind of throw diet and exercise out there with little finger quotes around it and not get super specific with people, who usually want to know, well, what does that mean? What do you mean diet and exercise? How and what and how much? And so one of the things I've really tried to do is actually stay within the canon of Western medicine and use what we call evidence-based medicine to look at what is the science. What have we learned about the healthiest ways to eat and the role of exercise, not just in preventing, but also slowing the progression of diseases that might already be present. So it's kind of a hopeful message, that we can keep things away from us, but also even if we're diagnosed with, say, type 2 diabetes or high cholesterol or high blood pressure, there are often things that we can do that can definitely improve our health, sometimes can even reverse the condition, but definitely improve our odds of doing well in the future. So that's my main point.
When you were in medical school, what were you aware of this sort of deficit of nutrition education, or were you kind of going along with the curriculum and then later discovered that you wanted to integrate more lifestyle changes?
I think that's a great question. I think a little bit of both. I entered medical school a little bit later. I had already been out in the world and working. I studied political economy, so I had maybe a slightly different framework for how I saw the world. But, when you're in medical school, you're just working really hard to stay up on everything they throw at you. So I was really, sticking with the plan and trying to learn it. And everything's fascinating and it's at a really high pace. And the way that my medical school taught nutrition was a very Western kind of reductionist approach, which was by the vitamins. Vitamin B12 does this. If you don't have enough, we call it this. In excess, it looks like this. And, so B12 and B6 and, vitamin K. And really, it was only 2 weeks and it was, nutrient focused. But there was very little that was integrated. And of course, that's not really how most people think about their foods. And I also don't think it's actually a very accurate way of thinking about food. Foods, there's a complex and beautiful biochemistry there, especially when we're talking about whole foods, where all the different phytochemicals and nutrients work often together. And so this plucking out of, one nutrient to talk about what it does is not the full story. And this is, I would say, really evident in our discussion around bone health too, where the focus was placed, and still is often, on calcium. And we don't hear a lot about magnesium or vitamin K or whole foods or all the other factors that may also contribute to our bone health.
And I think you would probably agree with me. People are really trying to do the best they can, but we're so barraged with conflicting information. Even those of us who are, somewhat in the field and pay a lot of attention to this kind of thing with, it's just so hard to keep up with fats are good, fats are bad, grains are good, grains are bad, intermittent fasting, yay, no, you should eat every 2 hours. And, most people don't have the time to try to go back and look at the scientific papers and literature. And I find that, my clients are just perplexed at what should I even do?
Yes.
And it's maddening.
Yes, no, I wholeheartedly agree. And studies often, depending on how the study's done, it may have a particular bias or the patient population. So even though I'm a fan of studies and evidence-based practice, I think we also have to hold it a little bit lightly sometimes, and not get super stressed out around these. Kind of do this, don't do that, and try to pull the lens back and say, well, what do we know about human physiology? What really makes sense? I have to say, I'm a huge fan of Michael Pollan's work. And I think for people who are interested, his book, In Defense of Food, is just a great, funny and well
Oh,
researched.
yeah.
And his famous rules about eat real food, not
Mm-hmm.
too much, mostly plants, really is evidence based, and we don't have to quibble too much. I also like to say, there's no good, there's no bad. It's about discernment and moderation,
Mm-hmm.
and our own
Mm-hmm.
preferences, and also our uniqueness, what feels good to us. Um,
Mm-hmm.
so you know, I like to dispel some of those myths, and in particular, a lot of the anxiety, because if you eat real food that looks the way it did when it came out of the ground, or came from the animal, and half the plate is vegetables, which I think more and more people are becoming familiar with, that kind of healthy plate model,
Mm-hmm.
that you're covered. You're really you're
Mm-hmm.
you're
Mm-hmm.
covered. Throw some olive oil in there. It's good.
And if you have an Oreo, you don't need to put
It,
yourself in a seclusionary state.
absolutely,
Yeah.
absolutely. People are sometimes, I talk a lot about sugar sometimes, and people will be shocked to hear that I have even a little added sugar every day. Probably
Mm-hmm.
we can tolerate a lot, and we don't want to get so wacky in our desire to be healthy that we're actually causing problems for ourselves.
Mm-hmm.
So
I
that's, yes,
yeah.
dispelling anxiety is definitely a desire of mine.
I was very curious to read recently that the anxiety around eating a so called non clean food or a bad food. It causes more problems and more distress to the body than the actual food.
It can, and that's yeah, and I don't want people who are worrying about food to worry about their worry about food. It's
Right.
almost just like a wake up call to trust the body. This is where I'm so grateful for my medical education, because boy, are we complex, and
Mm-hmm.
boy, are we resilient. And to just try to remember that, and remember that food is a source of pleasure and
Mm-hmm.
culture and
Mm-hmm.
comfort, and that's just as important as this kind of reductive food as medicine
Mm-hmm.
approach.
People
So
can
yeah,
get so hyper focused on it, and
yeah,
it's an easy thing to get, as you say, wacky about, because we're living in some pretty disturbing times, and I
yeah,
think
yeah,
it can be very comforting to say, I'm not eating any carbs today, and I'm not eating any
right,
sugar, and it all has to be
right,
kale.
right,
What a love.
right,
That's a
right.
lot more, I think, calming to think about and
Yeah.
helpful to control than, what's happening in North Korea.
Right.
So, yeah,
Right,
right.
right. But then, are there harms from that approach too? And so, yeah, if I can make people feel good about their little couple of squares of dark chocolate, great.
Hmm.
I've done a good thing for the day.
Hello, Zestful Agers. First, I want to thank you so much for your enthusiasm and interest in the podcast. Words cannot really describe how fun it is to make this for you. We are now in the tens of thousands of downloads, and Zestful Aging is still very young. We've heard from inspiring women from all over the world, and I hope it has made your life richer and helped you be more zestful as you navigate aging. In addition to being fun, making a weekly podcast is a surprising amount of work. So I want to encourage you to become a patron today. It's the way I can continue bringing you in-depth, thought-provoking interviews without sponsorship, aka commercials. And I've added a special free gift just for being a listener to the podcast. It's called my Best Ever Self-Care Manual. And again, it's based on research and my 25 years experience as a psychotherapist. So hop on over to patreon.com/zestfulaging and download the free manual. And while you're there, donate what you might pay for your cup of coffee today. It will make you feel good. I promise. That's wonderful. Can you talk specifically about bone health? You have a retreat coming up at the end of August, and I know a lot of people post-middle age worry about their bones. We've been talked to about calcium and making sure, your bones don't break in half. And it's just sort of another thing on the worry list. Can you talk a little bit and put some perspective around really where should we be putting our energy right now?
Yeah, thank you. So the first thing, I like to put the whole discussion of osteoporosis and bone health in context. And the first thing that I want to just remind people is that, the lightening of the bones, the loss of bone mass as we age is a normal part of aging. So, this is just a pattern that we see over time. And there are lovely graphs showing that, during childhood, we're building bone mass and bone length. And, over our 20s, the length stays preserved, but we're still accruing some mass. And then, for most of us, once we hit 30, and this is true for men and women. For women, the loss drops off a little bit more sharply after menopause. But for all of us, this slow, kind of decline after our 30s is normal. So it's expected. So there's nothing pathologic about bone loss as we age. This is why I pair with the dean of Kripalu's School of Ayurveda. Ayurveda, if people aren't familiar with it, is we like to call it the sister science of yoga. It's the traditional medicine of India, and it's very lifestyle based, very preventive, very lovely, often intuitive and poetic way of thinking about not just what we eat, but kind of how we move through our day, how we think, very intertwined with yogic principles. And for thousands of years, they've had a framework for this lightening as we get older. And so they haven't worried about it the way we kind of panic about this loss of bone. They just see it, well, this just makes sense. It's just part of aging. We get lighter. And so just remembering that, I think, can be helpful. And the other thing that I, want to help people with is just remembering what the problem really is and where our focus on and where we even started to even talk and define osteoporosis came out of the observation around hip fractures in particular, and noting an association between hip fractures in the elderly and risk of mortality. That this was really something to be concerned about. That when people who were kind of frail and elderly broke their hip, that was actually a pretty serious condition, and the risk of dying within the next 6 months seemed to go up. And so the focus was really about that finding. And so, kind of what is this about, and how can we prevent hip fractures in particular?
I see. So do you think that there was a way in which we got a little off course here, that it was about hip fractures and perhaps hospitalization and perhaps infection and perhaps sort of a cascade of other problems. And then we got really focused on osteoporosis.
Yeah, I think one of the things that happened is, we kind by looking into, well, why has this happened? Why are some women fracturing? And then a tool was developed to try to figure out why that might be, and that's where the bone scan came out
Mm-hmm.
of.
Mm-hmm.
And one of the other things that I like to, just kind of remind people is that bone density is just a proxy measurement for bone mass. It doesn't measure the strength or resilience of bones, right?
Mm.
So if we picture, if we realize that bone loss is a normal part of aging, and we kind of picture the most agile, elderly woman we can think of, her bones are smaller, or less dense than they were when she was 30, but they may still be strong and resilient. It's
Ah,
Do you see what I'm saying, right? So
yes.
so there are kind of all these steps that happened along the way. So the screening tool is measuring something that's important but is not the only risk factor. And so I want to share with you some data, a study that was published in the New England Journal of Medicine, looking at risk factors for hip fracture. And there were
Mm-hmm.
some uh, limitations to the study. It was done mostly in Caucasian women because white women have a higher risk of both osteoporosis and are more likely to fracture. But what often surprises people is learning that low bone density is just one of many risk factors for
Mm-hmm.
hip fracture. And again, it was really hip fracture that we were worried about, that we can have low bone density and still be healthy and okay. And so things like ingesting a lot of caffeine, so usually more than like 4 cups of coffee a day, smoking,
Mm-hmm.
spending 4 hours or less of their day on their feet, so being very sedentary,
Mm-hmm.
having hyperthyroidism, or taking what we call these long acting benzodiazepines. I'm sure in your work you're very familiar with these. These are
Mm-hmm.
treatments for insomnia and anxiety,
Mm-hmm.
like lorazepam. So there are
Mm-hmm.
medications that put us at risk, along with things that we don't have. So all of that we have, a certain amount often of control over. And then there are things that we can't control, like our family history, whether or not we're tall. And one of the things that I like about bone health, because we have such a fixation on being thin in this culture, and that actually gaining weight after the age of 25 helps our bone health.
Mm.
So let's hear it for a happy story on weight gain, because we never get to hear those. So weight loss or being too slender can be a risk factor. So just really putting it in context, and actually, if you look at the graph, which unfortunately I can't, show you because we're talking, but it's how many risk factors are present is much, much more important than the bone density itself
That's
in
fascinating.
terms of our risk. And so
Mm-hmm.
that's what I like to really start with in this program. And like, let's think about that, and let's look at the risk factors and what do we have control over, and even more importantly, how do we stay healthy and strong? How do we prevent falls? Let's put it
Mm-hmm.
back again onto
Mm-hmm.
the real thing, which is avoiding, keeping ourselves strong and healthy, and then also avoiding the situations that might make us fall and fracture, and not obsessing about a single measurement, i.e., bone density, which may or may not actually tell us how strong or resilient our remaining bone tissue is.
I
So,
have
does that make sense?
it makes a lot of sense, and it makes me wonder about all the advertisements we see, and even celebrity endorsements for
Right,
like Fosomax and all of these
right.
things, and it makes me wonder if this kind of became a thing because, not to sound too cynical, but pharmacology might
Right.
say, hey, we have a
Right.
pill for that.
Right. Right.
Okay.
Exactly.
Okay.
Exactly.
Okay. Now, can you talk a little bit about we looked at risk factors. Talk a little bit about what we can do to in terms of prevention. I know that, especially as a person who works at Kripalu, you know a lot about nutrition and exercise. Can you sort of weave those together? What are the general recommendations you can make for us?
Right. Well, I'll start with movement because there's so much, beautiful data on this that really staying active, that exercising for at least about 150 minutes a week is really important, not just for preventing hip fractures and preserving bone density, but for preventing pretty much all of the chronic diseases, type 2 diabetes and heart disease. It keeps our blood pressure regulated. It helps us maintain weight loss if that was something we were interested in. It's actually, you probably know this, I'm sure, it's a very good treatment for, moderate or mild depression and
Mm-hmm.
anxiety.
Absolutely.
So it's just
Even ADD too.
yeah,
Yeah, we're seeing. Yeah.
yes, yeah. So that is so important. And then kind of so and some people and again we just get so anxious and worried and I see women, trying to lift weights all the time because they hear that weight
Yes.
bearing is really
Yes.
what's
Yes.
what's
Yes.
needed. And I hate those little hand weights and so walking is weight
Okay.
bearing. Exercise, yoga postures where you're holding up, your own body weight and you're holding up your arms, that's weight bearing. Jumping rope,
Mm-hmm.
that we can do, kind of moderate impact that
Moderate
doesn't
impact.
require a gym or
Oh.
any purchases. We
You're
can,
speaking to the choir, right? You're
yeah,
singing to
yeah,
the choir.
yeah,
Now,
yeah.
let me just ask you, this is purely selfish because I've been a walker since it wasn't even cool when I was walking. But now we hear a lot about, well, you should get your heart rate up and then you can walk. And can you talk and walk? Are you breathing hard? I mean, basically, I'm looking at a moderate pace with at
Yes,
least one dog with me.
yes.
So there's got to be some stopping and picking up tennis balls and other assorted things,
Right,
you have to
right,
pick up.
right.
Is that in the ballpark, or there's more to think about when you recommend walking?
Oh my goodness, no. I mean, because I work with people who are, really quite out of shape and deconditioned. So I start with a very low bar and any walking. I'm just excited if people get out there
Mm,
regardless of the pace because, what I had
mm-hmm,
just mentioned before, sitting is a risk factor. So any movement starts to
mm-hmm.
put us in the right direction. And then most of the data is really around this magic number of like 150 to 180 minutes of moderate to vigorous.
Mm-hmm.
So, we're like you just said, like, we can keep up a conversation. We might take a breath or two in the middle of speaking. That is enough. If some people are fitness nuts and they want to get into high intensity interval training, and there's some data on
Mm-hmm.
that, and I say, God bless them. But, just the 150 minutes of walking, there's so much beautiful data behind it. That is sufficient. And, I
Yes.
love to ask people, what's the best kind of exercise? And of course, the answer is the one that you like to do,
Oh, yes.
right? Because
Oh.
then it's a habit
Oh,
and we
yeah.
actually do it. So yes, it sounds like you're doing great.
Yeah, well, I have my own. I interviewed Florence Williams, who wrote this beautiful book about. It's called Nature Fix, and I
Mm-hmm,
recommended it
mm-hmm,
to
mm-hmm,
one of
mm-hmm.
your colleagues.
Yes,
And the health of getting outside, forgetting about if you're walking or sitting on a bench, is
yes, yes,
so profound
yes.
that that's worth the price of admission right
Yeah,
there. So I'm a big
absolutely.
fan of outside, fresh air,
Yes,
sunshine,
yes.
and dog walks.
Right, and you had mentioned the ADHD study. I have a talk on the science of forest therapy or being outside. So I am with you 100%.
Mm-hmm.
And another piece of this for bone health is sunshine, is getting out in the sun. There's some data on taking vitamin D as a supplement, but the best studies really show sunlight exposure as being protective.
Mm-hmm.
So I tell my folks 15 minutes on the face and arms most days. In New England, that for those of us who live here, that's
Mm-hmm.
between May and September, and that's without sunscreen. The
Okay.
sunscreen really keeps the body from making use of the sunlight and creating our own vitamin D. And so for people who burn, they're going to want those early morning hours before 10 or the
Mm-hmm.
afternoon hours after 4 so that they don't get sunburns. But we really need that time in the sun without sunscreen.
Mm-hmm.
Not a ton of hours, just 15 minutes
Mm-hmm.
most days. And we should be able to create the vitamin D that we need. And there's good studies out of Scandinavia, probably not surprisingly, because sunlight is a limited resource there,
Mm-hmm.
about the importance of getting out. And for those of us who live above Atlanta, Georgia, we probably want to take some vitamin D during the winter when we can't make as much.
Mm-hmm.
So, 2,000 a day, or I encourage people to actually find out what their levels are in
Mm-hmm.
November so that
Mm-hmm.
they can make sure they're getting their levels up above 30.
Okay, that's really helpful. So, what I love about this, Lisa, is all of this makes so much sense. And it's
Right.
just like going back
Right.
to the basics
Right.
of,
Right.
healthy nutrition, treating your body
Right.
the way it was meant, because bodies, of
Right.
course, are made to move.
Right.
And, there's a simplicity about it and it's just a sensibility that I think is
Yes.
so refreshing. I mean, I always tell the story of, getting the fancy blender and I'm blending raw kale and coconut oil and all this
Right.
stuff. And I went to my doctor and, she knows me. She knows what I do. She just laughed at me and
Yeah.
she said, "You are not supposed to be eating 15 vegetables that are ground. No wonder you have a stomach ache."
Right.
Um, but
Right. Right.
just this real sort of this very very basic idea of this is what we need to stay healthy, prevent disease, and even if you do get disease, this would be a very beneficial plan.
Yeah, and it'll help the things that we recommend, the mostly plants diet. If you like a little bit of meat as a garnish, fine. I don't think
Hmm.
we have to go, again, crazy on vegetarian versus vegan. Um, and taking the time to really enjoy it,
Hmm.
and moving and being connected to one another, and we're going to help our bones, but again, we're going to all of the worrisome diseases of aging, we're going to improve our risk of, like lower our risk for dementia,
Hmm.
and certain cancers and diabetes. So it's
Hmm.
just a good thing to do. And like you said, it's common sense. So we don't have to be specific for bone health. We can
Hmm.
follow the recommendations of the American Heart Association,
Hmm.
and that's going to keep our bones healthy too. The one
Hmm.
um, the one thing that is a little bit, I do love to, sometimes talk about coffee and alcohol and chocolate because people are so interested in
Yes.
those. And I'm a big coffee drinker.
Hmm.
So I have to be honest that bone health is one of the areas where it does seem that we have to be a little bit more moderate than maybe we want to. With things
Okay.
like diabetes, the studies show you can have 5 cups a day and you're just going to keep reducing your risk.
Uh-oh.
But with bones, it looks like 1 cup of coffee a day, maybe 4 cups of tea, because that has less caffeine in it. So certain things we have to tweak a little bit, but the
Mm-hmm.
basic recommendations stay the same across all the diseases we're trying to avoid.
And I'm going to say the most obvious thing, and I can only imagine you might be rolling your eyes, but no soda. No diet
Oh,
soda.
yeah.
No, okay.
Yeah. No, and
Yeah.
thank you for saying that. I mean, it's not, I don't drink it and I haven't for years, so I actually forget sometimes that
Mm-hmm.
people need to hear that. Yeah, especially the sugar sweetened, really any sugar sweetened beverage. And it's kind of good that you brought up smoothies because, I think we've gotten the message around soda, but they sell these in, concentrated fruit juice is not great for our bodies either. These fiberless concoctions. So I really caution people against, the lemonades, the fruit juices, the bottled
Mm-hmm.
smoothies, the bottled fruit juices, and just water. Learn to love
Mm-hmm.
water. It's good stuff.
Mm-hmm. Hmm. I remember being in line at Kripalu for coffee in the morning and celebrating the fact that I don't know what it's like. I haven't been there in a few years, but I actually met a woman that became a friend of mine as we were sitting, standing in line at the coffee counter, saying, "Thank goodness that they now have coffee and you can buy it." I know back in the old days it wasn't even offered.
Yeah, so now this might be news to you. Now they give it for free during breakfast. Isn't that
Ah,
great?
that is
we
that's
yeah,
wonderful. You
yeah.
listened.
Yes, we did the evaluations. It was the number one negative
Yeah.
evaluation, and we actually had a summit. All the health providers associated with Kripalu. We did a little evidence review,
Oh
and
my gosh.
again, it lowers the risk of liver cancer, type 2 diabetes.
Mm.
There are positives.
Mm-hmm.
Certainly for some people, this is where it gets individual. People may find it makes them more anxious or stomach ache, so
Sure.
this is where it has to be because we love it, and not, I would never tell anyone to drink coffee as a health beverage.
Mm.
But I also think that if we love it, we can enjoy that delicious 1 cup a day.
Deliciousness. Could you talk just for a moment about your retreat, what it's called, and when it will be held?
Sure. So it's going to be August 26th to the 28th. I think it's um, a Sunday to a Tuesday, and we call it Resilient Bone Health. And it's really an integrated program where I'm going to go in depth about many of the topics that I discussed with you today. I present the Western data, the studies showing different risk factors and how that impacts our bone health. I'll talk about the nutrients and how we can get them. Again, not just the calcium and the vitamin D, but all of the different nutrients and phytochemicals and minerals involved. And then Aaron talks about the Ayurvedic framework, which so many people find just fascinating and intuitive, and the critical role of stress reduction. One of the medicines that erodes our bones are corticosteroids.
Hmm.
So when we think about stress and stress hormones and the way that our body can produce cortisol, that's a potential pathway. It hasn't really been studied, but where really excessive stress could be another risk factor for our bones. So we really encourage self care. We really encourage slowing down, doing things that you enjoy, and the whole
Mm-hmm.
picture, not just nutrition and exercise, but again, social connection,
Mm-hmm.
supportive people in our lives, finding meaning, having
Mm-hmm.
having pets somewhere. I don't know that that's in the curriculum, but I always mention it at some point.
Absolutely. You're hitting
Critters
all the
we
ones.
love.
Yes, yes.
Yeah.
Yep.
So that's what we talk about, and there's time to experiment. Erin does some recipes, a lovely little treat that has a lot of sesame, which is a non-dairy way to get calcium that a lot of people don't know about. So
Mm-hmm.
she shares recipes and does yoga with people, and It's great fun. We have a
It
good time.
sounds lovely. It sounds like you hit a lot of points here, not just bone, but the whole person. And that's what,
Yes.
of course, Kripalu is known for.
Yes,
And
yes,
they, yeah.
and Erin does a little self massage too on one of the
Oh
nights, and
my
that's just
goodness.
lovely. Yeah,
Oh my goodness. So, and people can find that at kripalu.org.
sure, sure. You can
Okay.
go to my presenter page. My I think I'm listed as Lisa B. Nelson,
Mm-hmm.
and the program will be on there, or they can um, enter the search term "building resilient bones," and it should
Mm-hmm.
pop right up.
And I'm going to spell Kripalu for people who don't know about it. It's KRIPALU.org. And it is a treat, I will tell you, from being there. I always joke you go for the program, but you stay for the food. Oh my goodness.
Yes,
I've never
yes.
seen so many avocados in one place.
Right, and it's so
Lovely.
nice to
So
have someone
lovely.
else cook your leafy greens
Oh
because
my
those are very
goodness.
time consuming. So to have a whole,
Yes.
bin at every meal is just delightful.
It's delightful. Any other last words, Lisa, that you want to share before we say goodbye today?
I think just specific on, and I think you might appreciate this given your interest in time outside. And this isn't evidence based, but I like to encourage people as we age to still spend time barefoot
Hmm.
because spending time barefoot, we get to work all those, bones and muscles of the feet, and we can stretch our toes and really work on our balance. This is going back to the balance and agility piece. And because one of the
Ah.
things that happens as we get older is everybody wears those sneakers,
Mm-hmm.
and there's some concern. And again, but there hasn't been a lot of good randomized prospective studies about it. But if we're not getting good sensory input to our feet, if we're not challenging our feet with subtle changes in our terrain, we're
Hmm.
probably losing some of the proprioception and mechanisms for balance. So I really encourage people to walk around their house barefoot if they feel comfortable, to do their yoga barefoot, maybe even to
Mm-hmm.
step outside in their yard and just stretch their toes. And so that
Mm-hmm.
can be just fun again, because kids love to be barefoot. So why should
Mm-hmm.
that change as we age? And to think about foot health and again balance and agility as a key piece of this whole puzzle.
Mm-hmm. Mm-hmm. Well, very, very helpful. And I think I'm hearing birds in the background, which is
Oh, from my end here.
yes, which
Oh, yeah, great.
is
Yes, I do have my door open. We're trying
super.
to let nature into the house.
That is so lovely.
It's like a
another
cue. Yeah,
another piece of health
yeah,
is listening to the
yeah,
birds.
absolutely,
Yes, well,
absolutely.
I so appreciate you taking the time today and giving us a lot of concrete ways to help our general health and then within that our bone health, but not to get too over focused and frightened, but sort of taking a much broader view of how can I help myself stay healthy and prevent disease.
Yes, well, thank you so much. I really appreciated this. It was fun to talk with you.
Good. Good luck on your retreat.
Thanks. Take care.
Thank you so much for joining us on Zestful Aging. I love to hear from my listeners, so send me an email at NicoleChristina.com and tell me what you'd like to hear more about. I would also greatly appreciate if you could hop on iTunes and rate the show. Ratings help other people find the podcast so I can share all these good, juicy interviews with others. I would also invite you to become a patron of the Zestful Aging podcast. Hop on over to patreon.com/Zestful Aging and consider making a small donation. You will be eligible for insider only goodies and behind the scenes information, and it'll help you feel good knowing that you're contributing to the Zestful Aging podcast. I'll look forward to sharing more juicy interviews next week on Zestful Aging.